are on here. Okay, so now this would be that anterior thyroid cartilage, okay, and that would be the cricoid posteriorly. Okay. And so the opening through there is going to be, that's the glottis, okay, with the epiglottis on top. Okay, there's the epiglottis.
So is the epiglottis made out of cartilage?
Yeah, it's cartilage. It has, I mean, of course, it has an epithelium over it. Okay, but yeah, it's a cartilaginous structure. Okay. And there's the true and the false vocal cords. So again, the superior one's the true, the inferior one's the false. I mean, the superior one's the false, the inferior one's the true. All right, then, right beneath that would be the trachea. Okay, so the trachea is the tube here, the airway coming down the center. It has little C cartilages to reinforce it. The esophagus is right behind it. Okay. When it gets down towards the lungs, it splits into a left and right bronchus. Okay, so you might notice that the right bronchus is larger because, of course, the right lung is larger. But the other thing is it's also more vertical. Okay. This means that if a swallowed object goes down the windpipe, it almost always winds up lodging in the right bronchus, okay, because it's bigger and it's more vertical. It's easier to get in there. Okay. All right, and then these just, you can see they have the same sort of cartilage reinforcement. It's not quite as complete as it is with the trachea, but they have little cartilaginous plates in there to hold them up. Okay, and then where they divide, like here, okay, so that divides into two. Those are secondary bronchi. Okay, and if they had branches, they'd be tertiary bronchi. Okay. All right, and we've got the lungs here, and this is the diaphragm, okay, the breathing muscle. Right lung should be a little larger than the left lung. Okay. That's what we got for the respiratory system. I'll also bring out the hearts and stuff. I suggest that you review that really for the lecture exam. I think seeing a model will help.
You're going to be talking about the alveoli and all that stuff?
We don't really have models of those things.
Okay.
Okay. We just have like the big